The good news about this program is it's a 2-year program, and there are 6 sessions over the 2 years, which allows us to incrementally introduce it to our staff and incorporate it into our practice.
I took the 3-day course, and we were so impressed that we decided that we needed to know more, so we took the 2-year course.
Rather than going somewhere for a week or 2 weeks and learning a technique and then all of a sudden throwing that at your staff, I'm able to go home over a period of a couple months and some staff meetings, incorporate the different things I've learned, the different techniques, and it's much easier for the staff, it's much easier for me that way.
What prompted me to go was just the need to continually learn, and I wanted to improve in the area of diagnosis and surgery, I think, principally.
I'm not going to take every single thing and just follow it 100%, because I have to take it into what I believe, but there's room for that in this course. You're not being hammered, this is the only way to do things.
He has a great clinical staff, to watch them to be able to implement things like indirect bonding, interproximal reduction, some of these things that they talk about in the course, and you can actually go down in the clinic and watch them do it.
They give you the lectures on memory sticks many times where we can review it. I've been through the indirect bonding technique and placement technique with my staff. We've looked at the video or the PowerPoint presentation 3 or 4 times, and it was really on the 3rd or 4th time when they finally really got it. And so they have this program set up for success and to be able to utilize it in your office.
They cover so many factors of a practice, obviously the treatment, mechanics, and philosophies, but even how to go about incorporating each of the philosophies into specific examples of how you can incorporate it into your practice, how to work with how to talk to your patients, how to interact with your staff, taking records, how to finish a case. It's everything. It's not just one aspect of how to correct a certain type of malocclusion or how to just take photographs of a patient. It's everything. It's all encompassing. So it's truly a practice transformation.
It's not just a guy standing up there in the front of the lecture room, talking a big story. You go downstairs and he's actually, he's doing what he says. It's like he's basically everything that he says that he does. He actually does do it.
The time I spent in the clinic, I picked up some things that have already improved my practice.
This is by far the best course that I've ever taken.
I think this is the best because it's a small enough group that you get individualized attention and you can always ask a question and interrupt in a sense of finding out more about something. At the same time that there are many people in the group, enough that you get many different opinions and look at it with different eyes.
The one thing about this 2-year course that I've really enjoyed is that you feel like you're kind of back in your own orthodontic residency, because when you're in school, you have a classmate or two that you become great friends with, that you can share cases that are good or that are going well, that are going bad. You can bounce ideas off of them, even from the mechanics, but to staff problems, to whatever it is.
Very often we're alone in our decision-making process, and to have a group that you can kind of pick up the phone and talk to is kind of a meaningful thing, and I think I've had that opportunity by attending this course.
What I've really enjoyed is Dr. McLaughlin, how he has his systems in place and objectively discusses his cases and his treatment modalities so that you can reach that perfect finish, and you start with the end in mind.
This 2-year program has allowed me the opportunity to consolidate my thoughts on how I treat patients and also enhance my knowledge, and in particular in the area of orthodontics and surgical management of our more difficult cases.
Of all the systems out there, the McLaughlin system is the most comprehensive and most predictable in its treatment quality and result.
So I think for those people that are really wanting to, do quality and quality orthodontics and quality work, this is the place to come to learn it.